Hello, and welcome to our COVID-19 Town Hall. It's good to be with you all here in the studio, as well as virtually. Be sure to like, comment, and share this broadcast with your friends and family so that they can get in on this discussion. Let's take it over to the moderator, Reverend Ellis Godbee.
All right, good evening, good afternoon to those that are on Facebook and also YouTube Live. We do welcome you on this afternoon to our COVID Town Hall meeting. We are excited. We have some great panelists that are here today that is going to share some facts with us in regards to the COVID-19 virus, but also for the vaccine that is to combat the COVID-19 virus. I'm the Reverend Ellis Godbee Jr. I'm senior pastor teacher of the historic Spirit Creek Baptist Church. I am a registered nurse. I was born and raised here in Augusta, Georgia, live in Waynesboro. Currently, I am working for Merck Oncology in marketing and sales. And again, I am here as your moderator. We want to thank Reverend Dr. Clarence Moore for being our host at the Good Shepherd Baptist Church, and all of the audiovisual ministry people that have joined us here as well. We also want to thank Mr. Cedric Johnston from Augusta University for helping to coordinate this, him and Pastor Carlton Howard of the Noah's Ark Baptist Church. Again, we thank them for hosting and coordinating, and we thank you for joining us on this afternoon. We're going to get your questions answered. I know many of you have questions in regards to the COVID-19 virus. You have questions in regards to the vaccine, the safety of the vaccine, and we want to be able to have our experts answer those questions for you on this afternoon. And so you can chat in your questions in the chat box, and we'll be able to capture those questions, and we will get those questions over to our panelists on this afternoon. And so without further ado, I am going to introduce our panelists. I want to give you just a little bit of background of how we came to this moment. So about 2 months ago, we had Dr. Joshua White, one of the VP of Pharmacy Services and Director of Pharmacy at Augusta University, come, and he spoke to 65 pastors all across the central Savannah River area, and he gave us an update and some recommendations around the COVID-19 virus and also around vaccination. And so at the end of that very rich discussion, what came out of that was the idea to have another town hall that would be for all of those and anyone that would want to join us on Facebook Live and on YouTube across the central Savannah River area. So here we are today. We know that we're still facing a global pandemic, but it's not just impacting California or other parts of the world. It's impacting the CSRA here in Richmond County, Columbia County, Burke County, McDuffie County, Aiken County. All of the areas across the CSRA are being impacted tremendously in regards to the COVID-19 virus. To our panelists, I would just want to give just a couple of statistics that we've seen lately, and this is as of yesterday in regards to hospitalizations. So Augusta University, 102 inpatients diagnosed with COVID-19, 44 of them are in the intensive care unit. Doctors Hospital, 80 inpatients, 4 in the intensive care unit. Aiken Regional Hospital, 40 inpatients, 14 of them are in the intensive care unit. The VA Medical Center, 11 of them, 7 diagnosed with COVID are in the intensive care unit. Also, University Healthcare System, University Hospital, 142 inpatients, 25 of them are in the intensive care unit. And so first for our introductions, ladies first, so we have Dr. Kim Thompson from the Department of Family Medicine at Augusta University. She's going to be one of our panelists today and sharing information with us. Also, we have Dr. Rashad Darby, who is one of the Pharm doctorates and one of the managers in the community pharmacy at Augusta University. welcome. And also one of our long-term, actually I would say our homegrown physicians, Dr. Mac Bowman from the Heart and Vascular Center at University Healthcare Center. Welcome to our panelists. We're just gonna allow you to go ahead and make your opening comments. Take your time in terms of what you're seeing in regards to the COVID-19 virus, what you're seeing in regards to vaccination rates, and just share your experiences that you're seeing. We're gonna start with you, Dr. Thompson.
Okay. Well, good afternoon, everyone. First of all, I'd like to say thank you to Good Shepherd Baptist Church for hosting this town hall. It's so important that we open the conversation surrounding COVID-19, the virus, the vaccines, what is good information, what is misinformation. I always tell my patients there's no such thing as a bad question, but there are bad answers. So you want to know where you're getting your information from, and you want to be able to trust that information and share it responsibly. So I'm just a regular old family doctor. I am not an infectious disease expert, but I treat everyone. I treat infants, young children, adolescents, adults, elderly, and I have to educate myself when things arise that impact my patients, and I have children. So it really is important to me to be doing the right thing, to be teaching my patients the right thing, and I feel responsible if they don't do well, if they don't thrive. I'll give you a little background about myself. So I grew up in the Bahamas. I'm an American citizen now. I've been in the US since I was 16. I grew up somewhere where the only thing I knew really was the family doctor. The doctor delivered the babies, took care of your grandparents, came to your birthday parties, went to church with you. They were a part of the family, and we trusted our doctors. And I wanted to be one of those people. So I went to medical school in Chicago. I happened to marry someone from California, went back to California for 10 years, lived in Kentucky for 10 years. And I've been in Augusta now, moved here July in the middle of the pandemic last year. So I'm an Augustan by choice. I'm trying to lean all in. I love community medicine. I love my communities. And I have just been trying to surround myself with Augusta history to learn about the rich history of the people who have built Augusta. Every community, like I teach my residents and my kids, every community is an organism. It's made up of the families, the support systems, the churches, the schools, the hospitals. Every component of the community needs to be in sync, working to keep the population safe and healthy so that they can thrive, so they can go out there and do what they're meant to do in the world. So, I really get a unique perspective of how COVID has impacted us. Many of you may not have a relative or a friend who have really done badly with COVID. Maybe they've gotten symptoms and they've just had something like a cold or the flu, and you think, well, no big deal. I'm strong, I can fight it. I walk into some rooms, and this town hall today is hosted by Good Shepherd Baptist Church. Most of us are strong people of faith. I go into rooms with my patients, and they'll tell me, I'm not afraid of COVID. Jesus is going to save me. And they really believe that, and of course that is important, and I am as much a person of faith as I hope all of you. But God has given us wisdom. He has afforded us advances in science and medicine, and I think any one of us who maybe had a family member with cancer or a rare form of pancreatic cancer, for which there are experimental chemotherapies, we're not going to stand back and say, well, we're going to test God and let him heal them. We're going to take the medicine. We're going to trust him to give us clarity about what those best choices are and use what he has given us. So I think there is sometimes a thinking that if we turn to science and medicine, that somehow we're betraying our faith, or we're showing that we don't trust in God. And I think that's really something that our church leaders can help us to counter. Because I'm seeing that a lot in a lot of my patients who are still hesitant about taking the vaccines and taking the treatments that are there. You know, I tell people that I would never advise you to do something that I wouldn't do for my own family. I have elderly members in my family who've been vaccinated. I have 4 children with developmental disabilities from the age of 6 to 18. All of them except my 6-year-old, who isn't allowed to be immunized yet, have been immunized, fully immunized. And we are so grateful that we live in this country where we have that available to us. A question that I am faced with almost every day is, how can we trust these immunizations when we know that usually they take decades to develop, and all of a sudden they're pushing them on us in a year? And of course we know that there's such a horrible history of experimentation, especially on our population, with new medicines and treatments. But the fact about the coronavirus immunizations that exist is that there has been the rush is not akin to a shortcut. There have been no shortcuts in developing these treatments. So the coronavirus, so COVID-19, is a part of a family of coronaviruses. We all know about SARS, and we know about MERS, the Mediterranean virus, and the other respiratory viruses that have been around for more than 20 years. There has been research on how do we treat these coronaviruses for decades. And when the world realized that this latest version of the coronavirus was so deadly, so highly infectious, this was an unprecedented situation where you saw scientific communities from around the world coming together, escalating the approach to working and speeding up what they normally do to develop immunization. So they took all the decades of research, and instead of doing little steps that usually occur for immunizations in sequence, they kind of got all their resources together and started working on things in parallel so that you can see results really come about much faster than usual. So I tell my patients this is not a result of shortcuts, it's a result of escalating a response because we have been lucky to have had research on this kind of virus for decades. I just want to hone, to have the point that I leave you with, that I would never recommend anything to my patients that was not safe. I believe with every ounce of my ability that this immunizations, all of them that we have available to us, are safe and effective. The immunizations, the masking, those are the only tools that we have to fight this and to get some normalcy back. Everyone has been impacted. Even if you haven't had coronavirus or someone in your family has not had it, we have family members, we have patients who have cancer who are waiting for life-saving treatments and surgeries, who cannot get into the hospital because we are literally in a war zone. If you could get behind the doors and see what our housekeepers, our nurses, our doctors are dealing with day after day, you would really be floored. There's no way to really convey that with words. People are, who signed up to help heal and to help people be well and get out of the hospital, are cleaning dead bodies and holding hands of patients who are intubated who cannot see their family, because if you have a family member who's sick, you can't be there. It is a whole different experience than anything we've ever dealt with. It's very sad, it's very real. And it's not going away anytime soon unless everybody takes some responsibility to help it go away. I have lived in a few different countries, and one of the things I realize is that we value our freedom so much and our freedom to choose. But really, what is freedom if we don't have a country and everyone doesn't have access to it? So, we have a responsibility for our brothers and sisters. We are our brothers' keepers. And even if we may get coronavirus and not do well, my 6-year-old can't get the shot. Your 2-year-old can't get the shot, but maybe you can. Maybe you have the power to do something to help slow down the spread of this and help save lives. And that's a really powerful position to be in. So I hope that we all choose to do the right thing, not just for ourselves, but for our brothers and sisters, our parents, our children. I'm excited to answer any questions you all have and to turn it over to the ones who are more expert than me. But thank you for inviting me to be here this morning.
Thank you, Dr. Thompson.
All right, good morning, good afternoon. So I am actually happy to be here as well. Very excited to stand before each of you guys and talk to you a little bit about the COVID-19 virus, the vaccine, and provide a little bit of background on some of the science. So I'll do the same and provide you guys a little background on myself. So Dr. Rashad Darby, my current role is at the Augusta University Medical Center, community pharmacy manager and retail operations manager. I've been with AU now for about 2 years. Prior to that, I was with CVS Pharmacy as a district manager and pharmacy supervisor for 10 years. I've actually been in the retail pharmacy industry for a total of 22 years, dating back to being a pharmacy technician, a pharmacy intern, going to pharmacy school. I am a native of Orangeburg, South Carolina. Went to South Carolina State and majored in biology. So I started off in the sciences and still in the sciences right now. I received my doctor of pharmacy degree from the Medical University of South Carolina and currently reside here in Augusta. Married. My wife is a registered nurse. She works at university. So believe it or not, I'm working COVID-19 and talking about COVID vaccines at work, and I'm going home and we're talking about the same thing. She actually works in a step-down unit that actually treats COVID patients. So a lot of the information that I can provide to you is real-time, updated information. And I can't echo it any louder that, again, we are headed in a good direction when it comes down to this COVID pandemic. But believe it or not, the reason why we're headed in the direction that we're heading is because people are getting vaccinated. So the difference between us getting to the end of this road is how can we get every eligible person vaccinated? Because as she mentioned, there are only a few tools right now that's out there to help us deal with this pandemic. And the major one is the current vaccines that are out there. Right now, there's the Pfizer vaccine, there's the Moderna vaccine, and there's the Johnson & Johnson. As she mentioned, these vaccines, they just didn't show up overnight and someone approved them and say, hey, let's go and start shooting them in people's arms. They went through a rigorous process. The difference between the timing between how vaccines were approved with this COVID vaccine versus other vaccines has been the coordination of the government, the coordination of leaders. Financially, everybody just came together and said, hey, we have to do something to get this vaccine out to treat the patients and to treat the people in our environment so that this COVID-19 virus can go away. So I'll be happy, very, very happy to answer any questions that you guys have. I actually prepared some stats because I wanted to be sure that you guys were aware of how real this COVID pandemic is right now. And these stats are actually current as of September 16th. So nationally right now in the United States, just on September 16th, there were 127,000 new COVID cases, and there were 1,581 deaths. Now, that's just in one day. Wow. Just to give you some comparison to that, the United States for 2021 so far has been averaging about 3,000 cases per day. So it's not just something that you're seeing on the news. It's not just something that people are making it up. Again, as many of the panelists can tell you, we're in the hospitals, and we can tell you that it's real. And this COVID pandemic, can have a negative effect. 64% of Americans right now that are eligible have had at least one dose, and 55% of Americans have had both doses or what they consider fully vaccinated. I'll bring that home to the state of Georgia. The state of Georgia, just on September 16th, had 4,072 new cases and 197 new deaths. Just to give you a comparison, 54% of Georgians have actually only had one dose, and 44% are fully vaccinated. So as you can see, we are down from the national average. So we have some room to improve in order to get where we need to be to really eradicate this vaccine. Just in the last 7 days, the average number of cases have been 4,682, and in the last 7 days, the average has been 125 deaths. Just to bring it even closer to home to Richmond, Columbia, McDuffie, and Burke County, we are considered by the CDC as a high community transmission area. I can tell you, part of that is because we have some of the lowest vaccination rates, around. If you look at the data, and it's out there, it's on the CDC's website, some of the states and some of the counties that do have better stats when it comes down to COVID cases, they have more people that have been fully vaccinated. Just in the hospital, as the Reverend mentioned earlier, we're seeing a lot of cases, and we do a lot of breakdown of data. And when we look at the majority of these cases, the majority of these individuals that are being diagnosed with COVID have not been fully vaccinated. Now, again, there are a few that have been vaccinated that ended up getting COVID, but when you compare one to the other, there's a huge gap. There's a huge difference between the numbers. So again, it goes back to what I want to make sure that I keep echoing during this town hall is that we have to go out and we have to make sure that we get vaccinated, and then if we are vaccinated, we got to go out and we got to talk to our neighbors, we got to talk to our friends, we got to talk to our church members, and we got to encourage them to get vaccinated. The vaccine is safe, it's effective, the science has shown it is, and again, there are some things out there that they're still studying, and I'll tell you, I was on a call yesterday that occurred with the CDC, the FDA, it's basically a group of about 19 to 20 scientists from around the world. And when these vaccines or when these decisions go out, there were some things that they talked about yesterday that they said, hey, no, we are not going to push that. We're not going to encourage that because we do not think that it is safe. We do not think that it's effective. So please, for not any moment in time, think that when something comes out or some information comes out or some vaccine comes out, that it's just going to automatically be rushed out and it's going to be given to people. No, it goes through a rigorous process, and we want to make sure that that everything is actually safe to provide to the population. In addition to the vaccines, again, we still have to wear a mask. We still have to make sure that we're following social distancing. Part of one of the myths that's out there is that once people get fully vaccinated, they think that they're pretty much covered and not get COVID. Well, you can still carry the virus and transmit it to other people, even being fully vaccinated. The vaccine doesn't keep you completely protected. What it does is that it prepares your body that when you do get exposed to COVID, that you have the antibodies and then you have the immunity to help fight it off. And that's what's going to reduce the hospitalizations. That's what's going to reduce the death. So again, any questions that you guys have, again, I thank Good Shepherd. I thank all of the reverends and the pastors of the churches that I put this together, and I will be happy to answer any questions that come up during the panel and the town hall session.
Wonderful. Thank you, Dr. Darby. We'll hear from Dr. Mac Bowman now.
Sure. Good afternoon, everybody. It's a privilege and an honor for me to be here this afternoon. I'm a cardiologist, have been so here in the CSRA for 30 plus years. Among the things that I've seen during that time is the evolution of wonderfully advanced care for cardiovascular diseases to do with balloon stents, lasers, valves that we can put in easily from the legs instead of having to open one up. But I will tell you, among the things that at the top of the list of the challenges to me that I've seen in my medical career is the intricate involvement of all aspects of the cardiovascular system in the human organism at the mercy of the coronavirus, COVID-19. It is in one gigantic paintbrush across the world, the greatest medical challenge that we've had in all of our professional lifetimes. As has been pointed out to you, we see each and every day a plethora of folks who come into our hospital already infected. The vast majority of them, 95% of that 140, 150 or so at university, 95% of them are not vaccinated. We're losing 8 to 15 people or so per week. 100% of those folks, not in California, not in New York, but at University Hospital here in Augusta, 100% of those have not been vaccinated. As has been pointed out to you, the vaccine is the key. Yes, we still have to do the mechanical housekeeping, wearing the mask. We all came in with our masks. We're appropriately distanced in a closed room. The people in this room have been vaccinated, so that's a safe zone. But I guarantee you, when I was at a food ministry at a church before I came here, everybody working in the food ministry, we got our temperatures checked. We still wore our masks. We had plenty of hand wash around, as Reverend Moore and the staff have here at Good Shepherd. One has to understand, as Dr. Thompson pointed out, that this vaccine didn't just pop up. There's a young lady I always point out to folks that everyone should know. Her name is Dr. Kizzmekia Shanta Corbett, and I tell folks who talk about, well, it came too fast, and Donald Trump was pushing it, and if he's pushing it, I'm not going to be for it. And to be honest with you, that was my sentiment as well. But I also did my own research, looked back, and I knew that Dr. Corbett, who was the head of the Vaccine Research Center at the National Institutes of Health, when they started working on the Moderna vaccine, when they identified the genetic code for severe acute respiratory syndrome, Corona 2, COVID-19, she came to tears as she met with her team. She said, we have the answer to this. They had been working with messenger RNA models, that type of vaccine, and back to 2014, when we were dealing with H1N1 and Ebola and those things. She said, we already have the template to very quickly develop this vaccine. Yes, it is true, President Trump and the government helped to expedite by financing the work they were doing in terms of production, getting the research done, and all those things. But the template for that vaccine was already in place. And by plug and chug, not only was it in place for Corona-19, it is the reason that as other viruses come forward, and they will, there will be already a way that we can expeditiously develop vaccines to that. So please, those of you who, everybody Googles everything now, Google Dr. Corbett. She's somebody you ought to know about, and she's somebody that doesn't look like, doesn't talk like, doesn't act like President Trump, but much of the credit for the expeditious development of the vaccine doesn't go to warp speed in terms of the absolutes of the development, but goes to her team. She's now at the T.C. Chan Public Health Department at Harvard University, but she was the young lady at the National Institutes of Health who was directly responsible for the development of the Moderna vaccine. The Pfizer BioNTech vaccine was developed in Germany. It was not funded by any aspect of governmental money. It was all private development. What I tell my folks, and I've done probably 40 or so of these types of talks in the last year because it's extremely important to me. You have to know when you go down the echelons of involvement with folks with COVID-19, the folks most prone to not do well with the infection are Native Americans. Right behind them, hot on their heels, are us, African Americans. And behind us, closely associated in some groups, they're a little bit ahead of us, and some groups a little behind us, are Hispanics, Hispanic Americans, and then Caucasian Americans. And interestingly, the group that, at least in the United States, that tended to do least badly, but still can do badly, are Asian Americans. It's important for you to know, though, that regardless of your racial or cultural disposition, if you have predisposing factors, and many of these same predisposing factors are one that predispose you to have maladies that I deal with every day. If you have hypertension, if your weight is excessive, if you have diabetes, if you have asthma, if you smoke and you have chronic obstructive lung disease, these things all make your system less able to successfully contest the coronavirus. And as has already been pointed out, our major weapon is the vaccine. That vaccine, even if you have had it and there's breakthrough infection, that may occur because the vaccine's job is to help you make antibody. That antibody manifests mostly deep in the lung systems and in the blood. Doesn't do as much up top. So yeah, you may get the sniffles if you've been vaccinated. You may get a milder infection. But the folks uniformly that get sick, that come into AU, that come into doctors, that come into university, right now what we're seeing with the Delta virus, they are not vaccinated. What's so big about this Delta virus thing? We've had Alpha, we've had Beta, we've had the one from United Kingdom, the one from Brazil, the one from South Africa. What's so big and bad about Delta? Delta does what viruses do. They morph, they change. Why do you think we don't have a cure for the common cold? They can't live independently. They got to get in your cell, inhabit your cells, and partake of what that cell provides. That's what Corona does. That's what Delta does. Delta just does it better. They don't just come in and make a few copies of themselves. They increase the amount of virus they produce 1,000-fold. So with the original Corona, with the United Kingdom, with the South African, every person that got infected, they might infect 2 to 3 people. The Delta virus, on average, everybody that gets infected, they infect 8 to 10 people.
Wow.
I will tell you from University Hospital, last year when we were within the throes of just really doing badly with the virus, it took us about 6 months to get to 150 to 160 people. 6 weeks ago, brothers and sisters, we had 5 people in our hospital with COVID. As Reverend Godbee told you the numbers, this week, the last 2 weeks, we've had between 140 and 160. Wow. And what I'm seeing, my patients, not something I heard about, patients of mine, 2 that I've had come in, one from my hometown in Thompson, one from here, known heart disease, came in having heart attacks. We could not get them in the hospital. All of our ICU beds were full with COVID. And Cedric, it was a blessing with the cooperative nature of the hospitals in this area. AU had a bed that they didn't have they had a bed in the emergency room. They were able to admit my patient. Cardiologist cordially called me, told me what was going on. They took excellent care, had an emergency procedure, got his artery open, saved his life because he essentially coded on the table, which he would have done anyway. We did not have a bed. And so you look at not just the absolute price of an individual getting infected with COVID, but you look at all the other people who are put at risk in our community when we don't avail ourselves of the advantage of that vaccine, which all 3 of them have an equality in that they prevent severe infections, all 3 of them, they prevent death. So if you have your sniffles at home with a breakthrough infection or otherwise, your saturations are staying 90+%, you feel bad, but guess what? You feel better later on. And that person who's having his heart attack, or who has an acute appendicitis, or who has sepsis, an infection in the blood, they can get in the hospital. I tell folks over and over, one of my favorite lines, take advantage of what God has put there for us. It has been under the auspices of God's will that these vaccines have been developed as efficiently and as effectively as they have. He could make it all go away, but that's not what he chooses to do. There are lessons that we think about, we look at, and we see things that we do like this that we wouldn't have done otherwise were it not for this pandemic. So at the end of the day, the best weapon we have is the vaccine. So as I tell, every time I do one of these, I say, keep it simple. Don't press your luck, brothers and sisters. Don't press your luck. Yeah. Get stuck.
Amen. Very good. Well, thank you each of you for those introductory comments, and I am so thankful that you each pointed out that faith and science goes together.
Absolutely.
They're not mutually exclusive. Just to address, well, first I want to remind all of our viewing audience that you can chat in your questions, but I want to just bring up some of the questions that I hear and other pastors hear in regards to the congregation, the type of questions that come up to us. And first I want to ask, in regards to the three different vaccines that we have, the Pfizer, the Moderna, and also Johnson & Johnson, do you all have a preference? And just each of you would speak to that. Go ahead.
Well, I'll go first. The answer is no. If you have access to a vaccine, take it. I've had to answer this question over and over again. I have family in the Bahamas, in Hong Kong, and patients and family here, and everyone has access to something different. All of our vaccines have proven to be over 90% effective at preventing hospitalization and death.
That's correct.
So we haven't had vaccines this good. We are so blessed to have access to something like this, and you know, they're all equally effective. You're going to see breakthrough cases. Any vaccine that we've ever had over time is going to lose some of what we call its immunogenicity. So antibodies are going to, you know, their levels are going to fall with time, but your body has memory. And so when you get those attacks from viral particles in the community that get into your nose, get into your throat, yes, like you said, you may get the sniffles, but those antibodies and those memory cells are going to start replicating and coming to the defense and fighting it off. All of these vaccines have proven equally effective, so just take what you can get.
All right, great.
Is my advice.
Dr. Darby. Yes, and I agree. I had the Pfizer. That's what was available at the time when shots were offered. I agree. Whatever vaccine is out there that's available, they're all equally effective. I would throw one caveat out there. So again, as everybody's body is different, everybody's structured differently. You know, you got some individuals out there, females that could be pregnant. You got some individuals, as Dr. Bowman mentioned, that may have some cardiovascular issues or hypertension. You know, always make it a point to talk with your physician, to talk with your family doctor before you go out and get that vaccine, just to make sure that there's not anything that you need to be concerned or aware about. You know, one of the things I can think about right now is, you know, when you compare all the vaccines, Pfizer right now is the only one that's that's eligible for children 12 to 16.
That's right.
Moderna and J&J are not for that age group. So you just want to kind of keep those things in mind. But as she mentioned, they're all effective. They're all safe. That is the reason why there's only 3 vaccines out there right now and not 100. Right. There are a lot of companies out there right now that are trying to develop and get a vaccine and come to market and get the FDA to approve it. But guess what? They're not safe. They're not effective. So they're not out there for use in the general public. So that's why those 3 are out there, and that's why they're recommended, and that's why they're safe.
Yeah, and I think I agree with that totally. I think a couple of caveats. We don't know how blessed we are, but let me give you a couple of other numbers. The flu vaccine that we get each and every year, if you go back and pull morbidity, mortality figures that are readily available, the effectiveness of the flu vaccine, which I'll get next week, we have to get them every year at university. It's a mandate that we do. The effectiveness of the flu vaccine for the last 10 years has been 37 to 48%. The best it's done at preventing flu is 48%. But again, we take that as a staple because, you know, we get different groupings of flu viruses every year. When they look at what's happening in the Far East, they always put H1N1 in there, but every year there's a different collection of particular flu viruses that they vaccinate you for. But the best success rate has been 48%. Many of us in this room, like me, when I was in elementary school, went to my elementary school and took a polio vaccine on a sugar cube. Polio vaccine, because polio was running rampant in the 60s and the 50s and 60s. We think that, well, that vaccine's been very effective. The effectiveness of the polio vaccine, 65%. And so when you have vaccines that have effectiveness, the Moderna and the Pfizer are 94.5 and 95%. The Johnson & Johnson still very good by those standards, and the 65 to 75% range, but they all 3 are equal in prevention of death, prevention of severe hospitalizations requiring, severe illness requiring hospitalization. I will put one other caveat in for the Johnson & Johnson. In women younger than 50, there has been one complication that developed in a few of the 14 million people that have had this vaccine, less than 200 of these folks, and they were predominantly women. They developed a clot disorder involving the vein, the cavernous sinus, the vein in the brain. We have a treatment for it. We know how to not lose people to that. So they did make one change in recommendation that women under the age of 50 should not get the Johnson & Johnson vaccine. Men, we can get whatever. Older ladies can get whatever, but women, premenopausal women, they recommended that you get either the Pfizer or the Moderna.
Okay. All right, very good. I want to remind our viewing audience once again that you can chat your questions in. I want to take our panelists to another common obstacle that comes up that I've heard in my own congregation and in the community in regards to conversations around the reason why I'm not going to get vaccinated is because I'm healthy. I work out, I take vitamins. Could you all speak to that as well?
Yeah.
Okay, so I hear that a lot as well. Again, I have 3 healthy young boys who, we took out and have been immunized since April because I would say 3 things. One, I really believe strongly in that sense of obligation to one another. So if you may be fortunate to contract coronavirus and be asymptomatic or have mild symptoms, you still can carry thousands of viral particles and unbeknownst to yourself, give that to someone else who could die, who could end up in the hospital, who could suffer serious illness. I think the stats now are that about 50% of people who have recovered from coronavirus are developing what we call long COVID. There's so much about this virus that we do not understand yet because it is so new. But we are seeing patients who were never hospitalized who have cognitive difficulties, who are having to drop out of graduate school, who are developing signs of early dementia, who are developing clots that go to their lung. They're just, I don't want to take that risk. I don't want my children and my patients to take that risk. 50-50, that's not a great risk to take. And then on another note, I have had patients who have children in their 20s who have ended up intubated, dying, who have had no predisposing illness. So we see enough of that this is real. We don't know who of that healthy group will do okay. And there's no reason to take that risk. What we do know is that if you have been immunized, if you have not been immunized, you are 10 times more likely to be hospitalized, 11 times more likely to die if you get coronavirus. Would you walk into a room full of people with measles or chickenpox knowingly? No. And we know that the virus is out there. We're in the middle of a pandemic, so we are walking into just a cesspool of viral particles without protection if we choose not to get immunized. Yes, you may wear your mask, but these masks are not 90% effective. And most people don't wear them correctly. They pull them down over their nose or, we see that. They're hard to wear. It's hot and humid in Augusta. Thank you to everyone who wears them and tries their best to do it properly. But it's a very high risk still that if you do not get the virus, you do not end up in the hospital, you still can have significant, what we call morbidity from it, significant after effects. Or you can affect someone else who doesn't do well at all. And why would we want to live with that, you know?
So I'll make 3 comments on that. So a year ago, I probably would have answered that question and said possibly a healthy individual. But with this new Delta variant, the one that we're seeing right now, whether you're healthy, whether you're immunosuppressive, it bears no moment to who you are, what you're doing. In my household, my second thing is that I got 6 people in my household, and my 18-year-old was one of the ones that said, "Hey, you know what, Dad? I'm an athlete. I don't need to get the vaccine. I'm good to go." Well, just several weeks ago, He ended up catching it from his best friend, ended up, getting sick, not to the point where he had to be hospitalized, but just developed those symptoms to the point where he was kind of down and out for a couple of days, and he ended up testing positive. So yes, the COVID virus, whether you're healthy or not, can still, play a part as to like you catching it. And I echo what she says earlier. Again, as I mentioned earlier too, is that, healthy or not, you can still carry the virus. And what you don't want to do is you don't want to transmit it to someone that's not healthy, because the difference is that that person their body may not be strong enough to fight it off as a healthy individual could fight it off. The symptoms may differ. The symptoms may not be as severe. It may be a situation between, them being hospitalized versus not being hospitalized. The difference may be between them being, dying or not dying. And in the hospital right now, we are seeing healthy individuals, no, disease states, no history of anything, are, getting sick due to the COVID. So yes, healthy individuals can fall victim to COVID.
Yeah, absolutely. And like most of the people in this room, I pride myself on trying to stay physically fit, working out every day, good nutrition, those things. I will tell you that we have had, particularly with this Delta variant, we've had the predominance of our folks in the hospital are not like with the first and second and third wave last year. They're not 65 to 85. These folks are 20 to 50. And we had a couple of deaths last week of folks in their 20s, all unvaccinated. Wow. And as Dr. Thompson pointed out, no, not Dr. Thompson.
Darby.
Dr. Darby pointed out that right now the only vaccine that you can get for children from 12 to 16 is the Pfizer. So the only way you can protect those folks who are under 12 is that you be vaccinated and you wear a mask, and that's why it's crazy to me why they make such a deal in the schools about wearing masks. That's the only real protection those kids have: distancing, masks, ventilation, those things, and then making sure that you're not that carrier. Folks get on television and they talk about my rights and my freedom, and nobody can make me do this. My rights end when they negatively impinge upon yours or somebody else in the room. So none of us have the right to say our rights are so sacrosanct that we can not vaccinate, not wear a mask, not social distance, because we're free, and that's what being an American allows you to do. My rights effectively end when they negatively impinge upon one of my fellow citizens. And so whether you don't want to be a carrier, even if you are a strapped soldier and never to go down, you never get ill. You don't want to be a carrier. Last week, 1 out of every 4 COVID infections was in a child. 1/4 was in a child, and many of these children can't be vaccinated yet. So how do they get it? From folks who are carrying it. They may have been not feeling bad enough to be, inside and quarantine. They were out and about. And so when I go with my grandsons to Target or to Costco's, my oldest grandson, who's very, very ambitious and questions everything, he says, "Poppy, why are we the only ones in here with a mask on?" I said, "Because we're going to be the only ones in here that don't either catch it from somebody or give it to somebody if we're carriers." And he'll be 12 the 30th of next month, and we've already made arrangements that I said, "Your granddad's coming to Atlanta to get you, and we're going to go get your Pfizer vaccine."
If I may, something
Sure.
came to mind. I had a friend, nurse, who was telling me some of her story. She works in an ICU, and I mean, if you know anyone who's a nurse, talk to them about what their days are like. And something that really struck me was she said she's with a patient who has to get intubated. They're alert, they know this, they're not doing well, they have no family around, so what do? You have to help them call their family, to say, you know, I'm going to be unconscious for a while, say what they have to say, tell them they love them. Then they hold their hand, and she said she is so tired of hearing people say, do you think I can get the immunization now?
Yeah.
You know, will it help me? And for something that we have access to, for people who are, you know, disseminating bad information, you have no idea the harm you're doing to people. Because once you're intubated, you know, that's pretty bad. Your chances of surviving past that aren't great. So let's do what we need to do while we're healthy. And I hear so much this talk about rights. You know, what's the point of having rights if they're going to hurt someone else? We don't argue. We have babies, and we're not allowed to take them if we don't have a car seat. You know, we can't strap them in the seatbelt in the front seat. We have to wear our seatbelts, wear helmets. We have laws to protect one another, to prevent us from, you know, harming ourselves because of an accident that we can't control. And we can't control who gets this virus. But we can control who we help get the immunization, who we encourage to wear a mask. Yes.
Well, one of our panelists made a point earlier about having a discussion with your healthcare provider, and it becomes important in one other group of folks as well. One of the other very, very high-risk groups for COVID are pregnant women. Now, the American College of Obstetrics and Gynecology, as well as one of the larger colleges for children, neonates, pediatricians, they have now officially signed off recommending that pregnant women should be vaccinated. They are among the highest risk if they get pregnant. There have been no reported cases of any harm to the fetus, and the baby then is born already immunized. So, you know, a lot of folks say, oh no, I'm not going to do that because I'm pregnant. The experts who deal with pregnant women as their profession, as well as those with children, they have recommended that those ladies have that discussion with their docs and strongly consider being vaccinated.
All right. Thank you to our panelists for the great information that has been shared so far. Again, we want to remind our viewing audience that you can chat in your questions, and we're going to present these questions to our panelists. So we do have a question that has come in, and the question is, what are the current guidelines for small gatherings? Would you all speak to that? You want to start with Dr. Bowman?
Yeah, sure. I think that if you're in a small gathering, say 20 people, 25, say here, like here, if you are sure of the vaccination status, nobody is playing rope-a-dope with a fake card or whatever. Everybody there is fully vaccinated, and nobody was immunocompromised, so they didn't get the robust immune response. It is okay to be in that small gathering and be unmasked. If one is not sure, they do just what my grandsons and I do. Even though I'm vaccinated, my wife's vaccinated, all my adult children are vaccinated. If we're going to places where we're not sure that's the case, we mask, we do the distancing, and we avoid those high crowds of very vocal folks spewing, spittle and other oral contents that might have coronavirus there. So if you're sure of the vaccination status there, you have that leeway. If you're not sure, you ought to mask. And still, if you're not sure, going into an arena where you've got hundreds of people who may not be vaccinated, you're playing with fire.
Okay. All right. Dr. Darby or Dr. Thompson, any additional thoughts around small gatherings? Or we're in football season. Mention your experiences and your thoughts and recommendations around large gatherings.
So I'll go back to what Dr. Bowman mentioned around, when you're going into these gatherings, small, large, indoor, outdoor, many times you don't know the vaccination status of the group. So that's why the CDC basically recommends that you still continue to mask.
That's right.
Unless you're sure that, those individuals have been vaccinated. So for me, if I were to go to a football game right now, I would wear a mask, you know, for the reason that we mentioned earlier around keeping myself protected, keeping other individuals around me protected, keeping individuals that I may go around that may have an immunocompromised situation protected as well too. And I feel like that's the quickest way for us to get to you know, that stage in this pandemic where we're can see the end of the road and we can see the headlight where, you know, we're trying to put a stop to it. And I go back to looking at comparing, you know, kind of what's happening now versus last year where, you know, we almost got to a point where we kind of saw the light at the end of the tunnel, then this Delta variant kind of hit. But I truly feel like if more people would have gotten vaccinated, if more people would have adhered to some of the guidelines, that, you know, we may not be in the situation that we're in right now. It may still be a little bit of a tough road to cross, but it may not have been as big as it is. So, so I do encourage people to just to be smart and just to kind of, you know, think the worst case scenario.
And two, you know, you just look at the science, you look at the data. You look at the states where the Delta variant is rampant. You look at Texas, Louisiana, Alabama, Mississippi, and Georgia and Florida, and where you've got a quarter to a third of the hospitalizations and deaths are Texas and Florida. And you have the governors of those states, the leaders of those states, who are contesting every effort, whether it's wearing masks or mandating vaccinations by certain companies saying that you shouldn't do that. As Dr. Thompson was saying, freedom is great, but just take advantage of that freedom to live and live healthily and not adversely affect the health of someone else. And that doesn't mean drawing a line in the sand about taking advantage of a great vaccine or doing those tangible physical things still to prevent those infections.
Right. Freedom with responsibility.
It's a great term.
All right.
Great term.
So, you know, I personally, when I go out around my patients, small groups, I wear a mask. I've been fully immunized, but I have a 6-year-old, now 7-year-old, who is not. So I don't want to get a breakthrough infection or an asymptomatic one and pass viral particles to him or to my patients who are over 65, who are also, even if they are immunized, they're still in a higher risk group. And with this Delta variant, it's really thrown us for a loop. And the problem is, the more we allow the virus to spread, even in people, you know, who do not get symptoms, the virus changes. It's smart. It wants to survive. Right. And so we're going to be back, you know, into these surges if we don't break the cycle somehow.
You know, Reverend Godbee, the Delta variant is a thief, and it steals life. It steals health. Think of a thief in your own neighborhood. It goes to that first house and the door's locked, gates closed, can't get in. Goes to the second house, door's locked, gates closed, can't get in. Go to the third house, door's closed, got a dog in the yard, nah, not gonna get in there. Goes to that fourth house, door's unlocked. Oh, we live in a nice neighborhood, we don't have to lock our doors. Which house you think the thief's gonna rob? The fourth house. That Delta variant is, when you're not vaccinated, your doors are wide open. Your doors are not locked. And of the people who are at risk to become infected, it is you, the unvaccinated one. So getting that vaccine is critical. It is critical. Lock your door, get the vaccine.
Great. We have another question that has come in from our viewing audience. We know that it has been in the news. The Center for Disease Control and the World Health Organization has been talking about it. The pharmaceutical manufacturers that are producing the COVID vaccine is talking about it as well. Would you all just speak to why is it that I need a booster shot? Just speak to that.
So that's a great question. So, so just yesterday, the CDC, FDA met and talked about some guidelines, and as of right now, not everyone is being recommended to get a booster, which, and just for information purposes, the booster is just a third. It's just a third dose. It's not different in concentration. It's not different in an ingredient. It's just a third extension of the first and the second dose. And what they recommended was that immunocompromised individuals, because their bodies are not able to develop the antibodies and develop the immunity as fast as someone that may be as healthy, that it is recommended that they do get a third dose of the vaccine if it's Pfizer or Moderna. J&J, they're still trying to figure out and get some more data around that. They also discuss, individuals that work in, hospitals or individuals that are in nursing homes, individuals that are at higher risk for actually getting COVID. That third dose would be highly recommended. And part of the reason would be because the exposure rate, the ability for the virus to actually get in and cause harm, you're basically just kind of giving your body more giving your body more ammunition to fight it off in case it gets exposed to it. They did not recommend right now, but there's still ongoing studies, there's still ongoing research for individuals to just automatically get a third dose. So right now there's not a mandate. They are looking at the fact that people that got the vaccine early on, so back in December when the vaccine first came out, that yes, that 6 to 8 months, there may be some possible, kind of downward fall on whether or not your body has the immunity built up and is still there, but they didn't make any final recommendations on that. But that will come out in a couple of weeks, so they're still studying. There's a lot of data out there, there's a lot of research and stuff out there, but they want to make sure that they kind of look at it, from a bigger aspect before they go out and mandate something for everyone that may not be needed.
Right, I agree. And it's not that the vaccines are not effective. You expect the earlier you get a vaccine, 6-8 months go by, your antibody levels are going to be a little lower. And I think Dr. Fauci had said early on he wouldn't have been surprised if some of these needed 3 doses. They're learning this because, many vaccine series, the hepatitis B, you have to have 3 doses. Look at our flu shots. We have to get them every year. Tetanus shots every 10 years. So they are still effective. They're still safe. And again, they are still, even 8 months out, 90%, preventing hospitalization and death, more than 90%. So, we're just going to follow the science and get our boosters. Right now, immunocompromised, healthcare workers. And did they also approve for emergency authorization over 65?
Yes.
Because they were getting more
They did.
breakthrough.
Yep.
Yeah.
Over 65.
Mm-hmm.
And I think that's it's important to understand that as the further we get from having that second shot, that there is some decrease in your immunity. But again, you should be pleased and happy. The scientists in our country, the FDA, the CDC, from the times the first experimental vaccines were done, they have tracked, they continue to gather data. These are not just pull it out of the sky. They're saying they can tell you what the average antibody levels are at this level after this. But a key issue that some people with immune issues, people who are on high-dose steroids for rheumatoid arthritis otherwise, they may well not make antibody as readily. And it's probably going to be ultimately in those folks, it's going to be automatic that they're going to be 3-dose folks, because they found that when they measure the amount a fully healthy individual makes, the amount of antibody, that compared to somebody who's on chronic high-dose steroids because they had, or on CellCept if they had a heart transplant or kidney transplant, they don't make the same amount of antibody. So they're going to have to be treated more aggressively with that third, and they ultimately they won't even call that a booster dose. It's just going to be a third dose. The data is still coming in. Israel went to a provision of a third dose for all of their citizens, and they did show that there was some decrease in infection and otherwise, but still, the CDC and the FDA, they're rigid with what you have to find to say, do this for the whole population. Mm-hmm. It has to be unequivocally shown by the science, not just 1 or 2 people's opinion.
Okay, great. Want to get to some of these other questions. Another very interesting question to our panelists. When getting the booster shot, should it be the same type as the original 2 shots of the
Excellent
vaccine?
question.
So that's a great question. So if you, what the CDC and if they are recommending now, is that they prefer that you stick with the same manufacturer. But if it's not available, you can get that third booster shot from a different manufacturer. They prefer it be the same, but at the end of the day, they want to make sure that, hey, if it's not available, or if there's something else going on with the supply of it, they want that person to be fully vaccinated as far as what the guideline is at the time, so they are able to get that from a different manufacturer. Yeah, mRNA, yeah. Right. And again, J&J, again, there's still some data out there. They're still trying to figure it out. But as far as Pfizer and Moderna, if you've had 2 doses of Pfizer and for whatever reason you're eligible for the 3rd dose and the Pfizer not available, again, talk with your pharmacist, talk with your physician. You are able to get that 3rd dose of Moderna and be fine.
And there's some early data, early. And I was hoping they said something about it yesterday, but they didn't, that there might be a little bit more vigorous, and I want to say for a 3rd time, early non-confirmed data, that if you got a different mRNA vaccine, there might be a more robust additional response. So it'll be interesting if that comes to fruition.
Very good.
And this information will keep changing. So keep in mind that, again, as Dr. Bowman mentioned earlier, like, you guys go to Google, you guys go to Yahoo. I would empower you to, go to the CDC and the FDA website and read the information for yourself, because it's clear as day, and they provide the resources, they provide the studies, on all this information. But, it wouldn't surprise me with some of the information that they continue to study, basically, 3 to 4 weeks from now, that there may be new recommendations. So that's why it's real important to make sure you pay attention to what's being recommended and know the source as well, too.
And when you do that, when you go to those websites, I mean, you can see things, some questions that people ask about, metal chips and all this stuff in the vaccine. Yeah. They list every single thing in those vaccines. There's no aluminum, there's no metal chips, there's nobody's tracking you from Bill Gates or anybody like that. But the data is there. So when I have somebody who's contesting and is not sure, and they say something that I might feel is a little bit ludicrous, I never tell them that that's ludicrous. I respect and receive that, but I say, where did you get that data? Let's go back and follow that back to its origin and see if that's good data. If we're going to do this as something that might affect your living or dying if you don't get vaccinated, make sure that the data you're basing that on is real, is good, is vetted, it's been looked at by multiple sources, and there is not just an opinion but a consensus that says that this is what we ought to do. These are the facts.
Okay, great. We have 2 more questions that have come in from our viewing audience. I think we addressed it somewhat, but let's ask the question a little more specifically. Which vaccine is best against the Delta variant?
I think that, again, when you look at prevention of death, prevention of severe hospitalization requiring, severe infection requiring hospitalization, I think they all are effective. They all approach 95, 100% effectiveness at that. Now, Johnson & Johnson is a little less so against you actually getting infected. It's not in that 94, 95% range, but what we really want is people not die and people not have to come in the hospital, into the hospital. So they all are effective, have an effectiveness against the Delta variant. I think just like they're looking at everything else, I'm sure they're going to be able to come out with numbers ultimately to say this many % effective against Delta, this many, but that data is not out there just now. It's just still preventing death, preventing severe hospitalization, and all of them are effective with that.
And remember, pretty soon we're going to be talking about something, whatever is after Delta.
Well, Gamma's already here. Gamma's already been identified. It's been shown not to be as vigorous as Delta. Delta so far has been the one that's put it all together in its ultimate morph to make it the big boy in town.
I want to remind our viewing audience that in order for your questions to come in and be answered, we need you to chat into the Facebook platform. So we do have an additional question to our panelists. This is in regards to mask. What is the best mask to wear? And
Great question.
are
Great.
cloth masks effective?
Great question. Great question. You guys, I have an opinion. I have an opinion. I have an
Dr.
opinion.
Bowman.
The cloth masks are more porous, meaning if you really stretch them and look, the holes are bigger. So that means the particles that can get through there are going to be larger. The regular masks, the regular hospital masks, they're effective. They are okay. As Dr. Thompson said, you got to wear them right. You got to cover your nose. You got to cover your chin and make sure you don't have a lot of space. No question, though, the N95s are they weed out smaller particles of the things that are out there. The N95 or KN95. That's all I wear. I mean, I just said I just want the best I can have because I'm in the highest risk circumstances each and every day. So that's what I wear in my office. That's what I wear when I go anywhere. KN95s. Now, sometimes it's not. It was problematic to get those initially, but now, I mean, manufacturers, they're coming from all over, and they're gettable. But the gaiters and the ones that a lot of the kids like to wear that are cooler, that they also have bigger holes, so bigger particles can get in those, and they're not generally recommended a lot.
Right. I don't send my kids to school with cloth masks or gaiters. They wear what I wear at work, and when I'm really with sick people, I wear, the N95.
Right.
But it's too hard for most people to wear those every day.
Right.
So it is whatever mask you wear. The most important thing is to wear it properly. To wear it over the nose, over the mouth, not to pull it down. To wear it properly. So the first thing I always tell my patients is wear what you know you're going to be able to be consistent with.
And interestingly, we've had not a lot, but a few folks, because we never stopped seeing people face to face. We did some of the televisits, and that's fine because some of the patients didn't really want to come in. But we always, our staff, we had 17 people, all of them were vaccinated except one, and she was the only one in our office who got COVID, and she got an awful course of it. But we had several patients, not several, three, who came in, and there were overt, political reflections based on the hat that one of the guys was wearing, and he took it personally that he had to wear a mask. And I just told him, plain and simple, no mask, you won't be seen. And that's just the way it is. Everybody who comes in here, you got to wear a mask. I had one guy who actually left because we required that he wear a mask.
Yeah, sure. I want to bring up a topic that comes up very often, particularly in the communities of people of color, and this is in regards to the Tuskegee experiment. Would you speak to that as panelists, please?
It should come up. It, in one swell swoop, one of the most evil, diabolical occurrences in the history of the human race, where you had, as a governmental approach, you had the allowance of a group of several hundred men, African American men, who became infected with syphilis to just be observed. Come in routinely, tests taken, blood drawn, but not any treatment. Started in the 30s and continued on, and even after we had penicillin, which cured syphilis, these men were still just followed. They were never offered penicillin. They were never treated. Wow. Even when you had a therapy that cured, they went back to their homes, their communities. They did what younger men did, and they were younger at that time. Infection continuing to spread and proliferate. One of the most evil, diabolical occurrences ever. So one can certainly understand why one would have questions about things. But and I think that's why as you look for who coordinated this, who directed this program, who directed this development, what does the data show? That's all there. When the data was looked at, some young students from Meharry and Howard came to Tuskegee in the early 70s working with this, and they said, oh, well, we're seeing these guys today to do clinical evaluation. What is this Tuskegee study? And these were the guys that brought it forward, that these guys never signed anything. These guys have never been, this is the 70s. This program's been going on for decades, never been treated. Wow. That was the evolution of how that came forward. And then ultimately under President Clinton, where they finally, say, this was wrong. They stopped the program in the 70s, but they made a settlement with those folks and their families that were still alive. But by this time, folks had lived all their adult lives with untreated syphilis.
Wow. We have another question that has come in from our viewing audience. I want to remind our viewing audience again, in order for your questions to be answered, we need you to utilize the Facebook platform, and we'll get your questions answered. Next question to our panelists. Since we have had children go back to school and there has been an increase in cases, how has the death rate changed? Let's just address that first part of the question.
And I don't have the exact stats in front of me, but I can say that since they have gone back, I would just say that we've seen an increase, and I think Dr. Bowman mentioned earlier around what he was seeing in his hospital, but I think we've just seen kind of an increase in cases among, that age group. And some of it, I think some of the difference is that, again, 12 and under, there's not a vaccine available. There are some states where, masks are mandated versus masks not mandated. And I think that has a huge difference. Again, I think it's always going to kind of come down to whether or not, you have a child that's immunocompromised versus not immunocompromised, and then are we developing plans and are we developing policies to protect everyone? So I would say that, we have seen an increase because before, this was a virus that affected, 60 and 65 and older. Now with that Delta variant kind of surging a little bit, or in the past surging a little bit, it's just having a stronger effect on the population that normally you would not have seen it in.
Yeah, I don't have the data because it's new. We've definitely seen a new surge since schools have opened. We've seen young people sick and quite infirm. We've had deaths in children under 10. I think we had Aiken County schools, 4-year-old, 9-year-old. We've had 20-year-olds from the same. I had a father just last week, his 20-something-year-old son intubated, his 20-something-year-old pregnant daughter intubated. And, we've had thousands of kids in quarantine. So infection rates have gone up. And a part of this is because we're not encouraging those of the population who cannot get immunized to wear the masks. And in some cases, preventing them from doing so, which just baffles me. I've had patients come in and say, I think, with their chips in the vaccine, some people even think there's some types of monitoring devices in masks. And I usually pull out my cell phone and say, if they're worried about government tracking us, it's been doing it. They don't care about us, really. In terms of the tracking, it's, there's no real privacy. So yeah, the bottom line is rates have gone up, especially in places where they're not, there's mask fatigue, there's COVID fatigue, and there's this sense that, oh, we've been through it for a year, we did okay, but there, Delta has changed things, so.
And two, as I said earlier, 1 in 4 of the infections with Delta have been in children. Now, children don't always get real sick, but some do get real sick and they die. Over 450, 500 children nationally have developed this syndrome called the multi-system inflammatory syndrome. It is ultimately bad. It hits upon all of the adversities to do with severe vascular inflammation. It does like what Kawasaki's disease would do. inflames the vessels in the hands, the feet, the mouth, the upper airways. Those children get bad sick, and 450, 500 of them have died. So some of those people got infected by somebody else who was infected, passing it on to them. And that's less apt to be the case if you're vaccinated.
Okay, great. We have some additional questions that have come in through the chat. One of these questions, I think we pretty much have addressed it, but let me just read it. Secondly, how has the death rate changed for ages 40 and under since January? We know now that certainly the current pandemic, especially with the Delta variant, is a pandemic of the unvaccinated. So would you all just speak to that quickly as panelists? We do have some additional questions that I think are very important that we want to answer.
And I would say, again, just kind of looking at it from the standpoint of, and again, my wife is an RN, and of course I work at the other hospital. And again, it kind of goes back to, recently what we've been seeing with the Delta variant and the current surge is that, a year from now compared to today, we're seeing a whole lot more deaths and hospitalizations in that age group compared to before. Yeah. And a lot of it's that Delta variant it's just a lot more aggressive. So an otherwise healthy individual last year that would have gotten exposed to COVID, their body would have been able to fight it off and it would not experience anything, compared to now where that Delta variant, it just kind of throws them back for a loop, and they're now either having symptoms or hospitalized, and last year you would not have seen that. So,
okay, great. Next question to our panelists, and this is in regards to wearing masks. How do you avoid the fogging of glasses?
Let me know if you find out.
Well, I have a son who wears glasses, and part of the trick is making sure you have a good seal around the nose.
Okay, all right. Speaking to your mic, Dr. Thompson, just say that again.
I was going to say, I have a son who wears glasses, and it's a daily struggle for him. But if you have a mask that has a little bendy metal piece over the bridge of the nose, folding it properly over the bridge of the nose and then tucking the edges of the top under the rim of the glasses to make a better seal, maybe that helps.
Yeah, it's tough if you're talking to a patient, but it's not so hard if you're just quiet or listening. Mm-hmm. But if you're talking to a patient, I'm constantly pulling up and pinching. But it's a worthwhile effort. I try to keep it pinched and try not to, open my mouth as wide when I'm talking.
Okay. Next question. We know that we're starting to experience sort of COVID fatigue and apathy. And someone in our viewing audience wants to know, do you all think this virus will ever come to an end or get better?
I think that if you look right now, you can still, and some people who get flu, you will still be able to identify and genetically, with absolute certainty, identify some of the same flu strand of 1918. So I think that effectively you can say that though we will not always operate at pandemic proportions as we are now, I think there will be a level of the virus in the community, as there are with H1N1 and any of the other viral infections we've had. But we'll have better ways to control it. We have the vaccine. It may be, we don't know yet whether we're going to need to get a shot every year. We might, just like with flu. So I think that what we should avail ourselves of are the tools that God has allowed us to have brought forth to provide for His children in ways that allows the most effective and efficient control. We can control this virus, but we have to take advantage of the things that He's allowed us to have brought forth.
And I agree with that. And when you look at, again, when you look at the data, when you look at the science, when you look at, kind of the seasonal changes, when you look at, okay, hey, what was COVID doing before we got the vaccine versus what was happening after we got the vaccine, we've seen trends where things seem like they were getting better, based on controllable factors that we actually enforced or controllable factors that we did. So I feel like, and again, it's in my personal opinion, that if we continue to take advantages of what tools and resources are out there, that we can get to a point where the vaccine may not be totally eradicated, but it will be controlled. And, as our panelists mentioned, you think about the flu. The flu comes around every year.
Yep.
It doesn't get to a point where it's a pandemic, but it's because we've utilized the tools and resources that have been out there to try to control the flu. And I think that this coronavirus will end up being the same thing. But I think the key now is, what are we doing now to get to that point? Can we get there quick, or is it going to take us a long time because we're not utilizing the tools and resources, i.e. getting vaccinated, wearing your mask, et cetera?
Right, I'll just add to that. I agree with my panelist here. It is a coronavirus. The coronavirus is, part of the family of the common cold.
Right.
This isn't going to disappear, but I think that if we utilize the tools that we have, we're going to be more in control of it, and it will be less deadly. I know now at Walter Reed, they are researching a pan-coronavirus vaccine. I think we're going to continue to see exciting improvements in science and better vaccines. Again, we're going to have to be willing to take them and trust that the science is good. But we can get this under control. I just had to reflect when we were talking. I think it was March 6, 2020. I was still working at the University of Kentucky in Lexington, Kentucky, and I hosted a town hall for our community on the novel coronavirus. And someone was texting me as I was talking to our infectious disease experts, the governor just confirmed you have your first case in Kentucky.
Wow.
And that was March 2020. 18 months of thinking of all the twists and turns we've taken and the crazy, ups and downs. Who would have thought? So 18 months from now, I'm an optimist. I hope that we are all able to celebrate that we've, met the moment in history and we've helped our community do the right thing.
But Reverend Godbee, too, it's so intriguing to me that, there are the questions that the hesitant bring forward about, why, and this is why I don't. When you now, if you had a horse that you wanted to deworm, you would have trouble now getting ivermectin for that horse, because you have people who are getting this pill now, taking it because somewhere on the internet they found that ivermectin killed COVID. Same thing like with hydroxychloroquine, which is a drug used for lupus and otherwise, but it prolongs part of the EKG complex, the QT, that you can have a fatal cardiac arrhythmia if you take that drug for that. And when you look at even the Regeneron and bamlanivimab and some of the immunoglobulins that are infused to stop COVID, these are still emergency use authorization. They're not approved yet for generalized use. But the governor of Florida, like everybody, well, I'll get that because President Trump got it. And but it's no more. It had no more approval as Johnson & Johnson or Moderna. Right now, the only one that's routinely approved is the Pfizer for just generalized use.
Certainly. Well, certainly we want to thank our panelists for being here today. Last question as we begin to wrap up, and we're going to ask for your final statements. So our last question on this afternoon, and I want to let our viewing audience know as well that some of the questions that are coming in, if you will go back, as this is going to be archived on YouTube and Facebook, you can go back and listen to the presentation and to the questions that were asked earlier, and your questions are answered there by panelists. So last question to our panelists. Can the vaccine prevent pregnancy later in life?
Great question. That has not been shown to be true. There are some similarities with amino acid sequences, a very few that the vaccine affects. They're similar to some that are in the placenta. It has not been shown at all whether in interface with that placenta or with sperm and sperm count that's been looked at. The sperm count before you got the vaccine, sperm count after. It does not affect fertility. It does not increase the likelihood that there will be a reaction to that placenta and someone will miscarry. Otherwise, the American College of Obstetrics and Gynecology would never have recommended that it be given to pregnant women.
Right. I have a personal answer to that as well. I have a sister who's 30 years old who hesitated to take her COVID vaccine due to that very concern. And I had to counsel her and take that personal responsibility that I was giving her the right advice, and she's now fully immunized. The American College of Gynecology, the American College of Academy of Family Practice, and many others have 100% encouraged all women of childbearing age to get immunized, because when you are pregnant, your body is immunocompromised.
Right.
The danger of getting COVID and having a terrible outcome, as we've seen locally recently, is very high, and the risk from the vaccine is nil. So yes, if you are concerned about fertility, effects on unborn child, it is safe. So please get that vaccine.
And this will continue to be studied, just like with all the other things that are going on. I don't want the audience to feel like there's still a lot of unknowns out there, but all of these questions, all these things that come up, they'll continue to be studied, 6 months out from now, 12 months out from now, a year out from now. And as of right now, as they mentioned, there's just no data that supports that there are any issues from a male or female standpoint.
And if you go, you can, with Google and the other search engines, you can look at all this data. It's available. This is not done in sequestered circumstances. It's free and open, and I encourage you to do that. But as Dr. Thompson was saying earlier, talk to your docs. We know, we feel, we understand because of Tuskegee and other things. We take pride in being those resources, those advocates, and I'll have a conversation. If I don't know the answer, we'll go look it up together. But take advantage of that, and don't just draw a line in the sand and affect your health and your life because you fail to have that point of conversation.
Right, and I always think too, we have to acknowledge all the travesty and evil that's taken course over the course of history to our population. But even a greater tragedy will be to allow that fear and mistrust to prevent us from seeing what is good for us and doing the right thing.
And I'll say too, and I take hats off and give kudos to places here, Reverend Moore, AU, the pharmacy, the Augusta National Golf Club, the City of Augusta, Mayor Davis, University Hospital, the places, the University Healthcare System. They have made available this vaccine. The travesty would be that you have a life-saving vaccine that's put out in some communities but not in others. They have been over aggressively to provide, not where you have to go all the way over in West Augusta, but where you could come to Good Shepherd, go to Tabernacle, or Macedonia, or places where the vaccine is made available. So I think they realize there's been travesty, and they're trying to do everything possible that somebody can't say that, well, more black people die because they weren't able to get vaccinated. So don't let it be because we don't avail ourselves of the vaccine that's readily available everywhere. But I just want to applaud the Good Shepherd and AU and the institutions in this community that has made it readily available in every element of the community, even with AU and Augusta National, with portables that went out in the communities mobily to make it available to people who couldn't come to those institutions.
And I'll say the individuals that are out here providing the data, communicating the science, they've studied this all their lives. It's not coming from politicians, it's not coming from athletes, it's not coming from people that have other things in mind. Like, because I hear a lot where people are just not trusting the science, they're not trusting where the information is coming from. But, these individuals that have studied it for a long time, vaccines aren't new. They've been around for a century. This messenger RNA that's used in these vaccines, it's not new.
That's right.
So again, for many of the individuals that are in the audience, if you've gotten vaccinated, great job. So your duty next is to go out and talk to individuals and implore them to do their research and figure out what it's going to take for you to get vaccinated. Because, as we talked about earlier, I can see the light at the end of the tunnel just based on the information that's out there and what we have. But right now, it just kind of sits in the hands or it sits in the laps of the individuals that are out there to take, full purpose of the tools and resources and actually go out and utilize it. So.
Yeah, and be careful about your information. I mean, you look at people who have a platform, and it's not like this platform with this sort of balance going out there. And the young lady who was the rapper last week, Nicki Minaj, she had a third-hand comment. The boyfriend of this cousin of hers who got vaccinated, and whether from something else or whatever, he developed orchitis, inflammation of his testes. Well, she put this out as gospel that, well, if you get vaccinated, you might get orchitis. That has been looked at, has no association. When you look at what does antibody do to the testes, it does not attack the testes. And there are multiple causes of orchitis, inflammation of the testes, that people, urologists take care of all the time, have nothing to do with vaccines. But you look at where the data comes from. But some folks who have these platforms, boy, can you do some harm. And they were talking about I think on her Twitter feed, it was like so many million people who bought in, who received that information and processed it.
Dr. Thompson, final comments. We started with you, and if you would just give us your final thoughts on encouraging people to get vaccinated.
Okay, sure. Again, thank you for giving me a chance to come here and talk with everyone. I think what I'd like to get across is that we are in the middle of a really serious public health emergency, okay? Coronavirus is here, it's real, it doesn't discriminate. We have the tools to stop it, to change it, to protect our family, protect our brothers and sisters. If you've been immunized, I really behoove you to go and talk to 5 friends and tell them that they need to do the same thing. Talk to your doctor. If you're worried about what's in the virus, what's in the vaccine, I tell my patients, you've probably had every other vaccine that's out there. Do you have any idea what's in the MMR, what's in the tetanus shot, what's in the hepatitis A shot? I don't even remember. We know what's in this because it's been so scrutinized. And there are so many people who will go and take, the dewormers and the other medicines that you have no idea what they're doing to your body. So talk to your doctor, talk to someone you trust. Don't listen to the celebrities. If they get sick, they're probably going to be able to pay their way into an ER. But we have people who are sick who cannot come into the front of the ER because there's no room. You think you're going to go and get antibody treatment? Well, guess what? There's a waiting list. There's just so much we can do. We are in the United States of America, but everything has limits. Some of it is we have ventilators. We've got special machines called ECMO, but we don't have the staff because, the system is at capacity. So please, we need to be responsible for each other, not just ourselves. It's the right thing to do. You can walk in and get an immunization at CVS, Walgreens. Your doctors have them. I have them in my office. I ask my patients every day if they are not immunized, if we can do this today. So just please talk to your doctor. Please think about it if you haven't been immunized. And no question is a silly question. Just ask your question so you get the right information. We just want to get past this and quickly.
So I'll say, so as healthcare providers, we can all agree that our goal is to save lives. Your pastoral leadership, their goal is to partner with us and partner with many entities, and they have done that, and their goal is to save lives. So one thing that we can truly tell you is that the information and the things that we're seeing out there is real. I go back to something that we mentioned earlier, that in the hospitals right now, the people that we see on the hallways, the data that we're getting is real data. There are more people that are dying from COVID, that are being hospitalized, that have not been vaccinated versus vaccinated. So at the end of the day, we want to be able to encourage anyone that has not gotten vaccinated, go out and get vaccinated. If you got questions, ask questions. Talk to your healthcare provider. Talk to your pharmacist. Talk to your pastoral leadership. I'm pretty sure there are probably, members in your church that are tied somewhere to the healthcare industry that can provide you that information. But at the end of the day, we want everyone to go out and get vaccinated. I know that I'm tired of wearing masks. I'm tired of hearing about the social distancing. But we can get to that point, and we can get to that area where we don't have to worry about that once we work to eradicate the vaccine or minimize the impact that it has on our population. So again, I just want to thank the Reverend and the pastors for allowing us to be able to kind of sit and talk with you guys. My current role at Augusta University, look me up, email me. If you have any questions, if there's anything that we can do to support you or answer questions to allow you to be able to make that decision to get vaccinated, that's something that we really want to do. So,
well, it's very personal for me. I've been a part of this community for many, many years. I think it's one of the blessings of my life to be to be in this room where there are so many folks who share my passion to do the best for the people, the citizens of our city. Also knowing about always the absolutes of God's grace, His mercy, His intercession, and I see that even within the realm of COVID. I know that He already has the answer afoot. I know that, yes, He can make it all go away in a blink, but there are things that He wants and expects us to learn and to do with this pandemic, things that we do for each other, things that we do for our families, things that we do for the people in our church and people in our neighborhoods. At the end of the day, as we look back, as we come through this, as we will see those things, we will receive those things. And if we really think about it, you say, well, I might not have done that just that way if I hadn't had to go through the struggle. As with all struggles, if it doesn't kill you or irrevocably harm you, it makes you stronger. And with God at our backs and our sides and our fronts and above our heads and under our feet, we can't help but get through this thing better than we entered it. And that's what I expect will be the course for Augusta, for the state of Georgia, for the United States of America and the world as we contain, deal with, and grow forward through this pandemic.
Okay, great. Well, on behalf of our viewing audience, on behalf of myself, we want to thank each of our panelists for just a rich discussion, for the wealth of information. Again, we want to thank Dr. Thompson, Department of Family Medicine, Augusta University, Dr. Darby, Augusta University, pharmacy doctorate and manager there of one of the community pharmacies, and also to Dr. Mac Bowman, Heart and Vascular Center of University Healthcare System. Again, we thank you for taking the time out of your busy schedules to come and share the science, share the facts, because science, facts, and faith, they go together. Again, we want to thank our hosts, Reverend Dr. Clarence Moore and the Good Shepherd Baptist Church for hosting us on today. We want to thank Cedric Johnson from Augusta University for coordinating. Also, Pastor Carlton Howard of Noah's Ark Baptist Church for coordinating this event as well. Again, I'm the Reverend Ellis Godbee Jr. It has been my distinct pleasure to come and moderate this event. I want to leave it open, certainly, to our panelists, maybe in the future, because we know that all of this is a moving target and the information changes, that sometime in the near future that we can come back together again and be able to share what the latest information is in regard to the vaccines, in regard to the COVID-19 virus, so that, again, we can get people protected and save lives. Again, we want to
We're going to hold you to that.
All right, very good. Well, I've got some other pastors here, and I know that we're very interested in continuing to partner with you all as healthcare professionals, and again, getting the facts out there and dispelling the misinformation. So again, thank you to our viewing audience for being with us on today. And again, go out, get vaccinated, wear your mask, wash your hands, social distance, do all of the things that the scientists have told us that works to help protect yourself and protect your fellow man and protect your family. May the Lord bless you and keep you. Thank you again for joining us.
Thank you for joining us for our discussion today on COVID-19. We hope that your concerns and questions have been answered during this broadcast. We also hope that you'll be able to take the information learned from today and utilize it as we continue through these uncertain times. Again, thank you for watching and have a blessed week.